everybody. Um, okay, so in 2017, President Trump proposed that he wanted to stop government funding for Planned Parenthood because he said he's pro-life, which means that he's against abortion. And defunding Planned Parenthood ultimately causes Planned Parenthood to shut down. And with that being said, Planned Parenthood isn't just about abortions and terminating pregnancies. Defunding Planned Parenthood will make all the benefits of Planned Parenthood go away as well. So all the pros that come with Planned Parenthood will ultimately shut down with it. With that being said, at the end of my speech, it should be apparent to all of you guys that Planned Parenthood being defunded by the government has a negative effect in the U.S. And I will support this claim with the three following points. 1, defunding Planned Parenthood can cause many people to lose a healthcare provider. 2, defunding Planned Parenthood can cause harm to women's health and lives. And 3, the fact that Planned Parenthood provides health services to low-income communities and young women means that Planned Parenthood is very important to our society. To begin, defunding Planned Parenthood can cause people to lose a health provider. Without government funding, Planned Parenthood was shut down, leaving 700,000 patients without a reliable health service. According to the Odyssey Taylor Jacobs, the funding comes from Medicaid reimbursements, meaning that every time a patient gets treated at Planned Parenthood, Medicaid will reimburse the clinic. And if you guys don't know, Medicaid is a government-funded health insurance for low-income families and individuals. And Planned Parenthood is also funded by Title X, which is the U.S.'s family planning program. According to I Stand With Planned Parenthood, if not for the Planned Parenthood health services, Medicaid would result in about $130 million to taxpayers over 10 years due to the increased number of unplanned pregnancies, which is just another fraction of why it's unbeneficial for the U.S. that Planned Parenthood would get shut down if it was defunded by the government. So because Planned Parenthood is focused on providing for low-income communities and young women, both those categories will not have affordable or easy access to their OBGYN or family planning methods. Which brings me to my second point. Defunding of Planned Parenthood by the government causes harms to women's health and lives. So without Planned Parenthood, young women and teenagers of any gender or sexuality even will not be able to easily, comfortably, affordably afford treatments for STDs or birth control methods, etc., etc. For example, a main one that a lot of young teenagers go to Planned Parenthood for is for doctor and patient confidentiality. And Planned Parenthood offers young women to have free birth control if they don't have health insurance and provides antibiotics at a free to low cost. And most of the time, as a young woman or as a young teenager, having an STD is something that you don't really want to tell your parents. So going to the certain extent of going to Planned Parenthood, and they allow you to have that benefit as a patient there. So Planned Parenthood is the primary birth control provider. Without it, women will have thousands of unplanned births. With being thousands of women's healthcare provider, women will have to result in having unsafe pregnancy terminations, leading to possible deaths. Although the government doesn't fund abortions, with Planned Parenthood being defunded and shut down, many women who use Planned Parenthood as a provider won't have a provider to terminate their pregnancy or prevent unwanted pregnancies. For example, if a pregnancy was a result of rape or incest, they wouldn't be able to affordably or comfortably terminate their pregnancy, because if they were living in a low-income area, then Planned Parenthood would not be the sole provider for that. And finally, Planned Parenthood provides health services to many low-income communities, and young women. Medicaid recipients get Planned Parenthood covered, serving low-income families and individuals. Planned Parenthood also provides free birth control methods and options for women who are qualified based off of low income or stance on health insurance, or if you don't have insurance at all. Families USA, the voice for healthcare consumers, says if politicians ought to defund Planned Parenthood, they would block millions of patients who depend on Medicaid and other public health care programs from accessing care at Planned Parenthood. Women's health services, including checking for cervical cancers, pap smears, breast cancer screenings, STD testing, pregnancy tests, and more, will no longer be able to be available for young women. And incomeless teenagers who use doctor-patient confidentiality to the full extent will no longer be provided of that service. So, in conclusion, being able to access health care at Planned Parenthood is crucial to many people, and government defunding Planned Parenthood will have a heavy downside effect in the United States. Without Planned Parenthood, many low-income patients wouldn't be able to get these services anywhere else. Thank you.
Oh, yeah, okay. Nobody needs those things, I'm sorry. You need this can, you gotta have all that stuff. There you go.
All right, Ivy, the proposition's clearly stated. There's a preview of the supporting structure that's easy to follow. I think the idea of defunding Planned Parenthood, you could demonstrate, is a little bit more controversial, but I think most people who are familiar with the argument know that there are plenty of controversies on it, so it wouldn't be hard to maybe make it a little bit more lively as an issue, but it was fine. The signposts in the body of the speech were not quite as clear as they were in the preview, so you want to be a little bit more consistent on that, especially on the first point. The third point, I thought that your information was a little bit less sound than what you had on the first and second point. There is some information that's missing in the argument. The notion that Planned Parenthood would cease to operate without the government subsidies that it gets. Number one, you need to make sure that that's all due to the Medicaid thing that you say disappears, and it's not the Title X funding that you're talking about, because the Title X funding, I think, is the thing that they're talking about defunding. I'm not sure if it's the Medicaid thing also. If it is, then you need to make sure that that is clear. The other thing is that we need to know what are Planned Parenthood's revenues and how much of it is supplied by federal funding, because then we would know whether or not they are really likely to go out of business. The other thing that I think there's a presupposition that other places are not available to provide these services, and you need to make the argument that says Planned Parenthood is the only source that is available for these kinds of things. The notion that women or anybody else wouldn't be able to get access to birth control seems to be a little bit hard to believe in these times. If you go to high school, you can get access to birth control. You just got to go into the nurse's office. If you go into the bathroom, men are going to have access to birth control, and in some states they have talked about turning birth control pills into an over-the-counter drug medication. So why that becomes an issue, I'm not quite sure. That there are people who utilize the services of Planned Parenthood. I think you did a good job showing that there are people that utilize those services. What you do need to show is that they would not have access to other services should Planned Parenthood disappear. And so you've got a presupposition that Planned Parenthood would disappear, and I think you need a stronger argument on that. And then there's an assumption that they wouldn't have access to other resources, and you need a stronger argument on that. I think you start walking on that third rail of politics, as they start to say on the last point, when you talk about access to abortion issues, because I think if you are potentially feeding a huge rebuttal argument that says, oh, well, they won't have access to abortion if Planned Parenthood disappears, good, because that's the reason that they want to get rid of Planned Parenthood. And now your issue is going to switch from whether or not there's access to birth control to whether or not there's access to abortion, and people who are opposed to abortion for a variety of reasons would be making arguments about that. That becomes a potential kind of disadvantage argument that turns around and becomes an advantage for the policy that you're talking about. All right, thank you.